The parents of a term 1-year-old girl are concerned because the child's head seems abnormally large. Their pediatrician notes that the child's head circumference has accelerated beyond her established growth curve in the past month. Axial CT of the head demonstrates dilated atria of the lateral ventricles, a rounded third ventricle, and a normal-sized fourth ventricle. What is the most likely diagnosis? Hydrocephalus is defined as an excessive volume of cerebrospinal fluid within one or more ventricles of the brain. Because cerebrospinal fluid cannot flow freely through the ventricles to enter the subarachnoid space, this case is an example of an obstructive hydrocephalus. CT scan of the head in this patient shows a dilated ventricular system with dilated atria of the lateral ventricles and rounded third ventricle. Cerebral aqueductal stenosis, a common congenital malformation, is the most common cause of obstructive hydrocephalus. In contrast, in cases of communicating hydrocephalus, there is normal flow of cerebrospinal fluid, but an imbalance between cerebrospinal fluid production and reabsorption. Other causes of disproportionately large head size or growth include trauma, Canavan disease, and Hurler syndrome. Canavan disease is a fatal inherited leukodystrophy caused by aspartate deficiency, resulting in toxic N-acetylaspartate accumulation, impaired myelination, and progressive white matter degeneration in the infant brain. Hurler syndrome is a fatal autosomal recessive lysosomal storage disease caused by alpha-L-deuronidase deficiency, resulting in systemic glycosaminoglycan accumulation. It can cause profound multisystem morbidity. Where is cerebrospinal fluid produced? Cerebrospinal fluid is produced by the choroid plexus epithelium in the ventricle, especially within the cerebral ventricles. The lateral ventricle communicates with the third ventricle via the foramen of Monro. The third ventricle communicates with the fourth ventricle via the cerebral aqueduct of Sylvius. The fourth ventricle communicates with the subarachnoid space via the foramina of Luschka, laterally, and the foramen of Magendie, midline. How is cerebrospinal fluid reabsorbed? Arachnoid granulations, composed of arachnoid villus cells, are located in the superior sagittal sinus and connecting venous lacunae. The villus cells return cerebrospinal fluid to the bloodstream within vacuoles through a process called pinocytosis. What forms the blood-brain barrier? In the central nervous system, tight junctions between capillary endothelial cells form the blood-brain barrier and regulate the passage of water and solutes into the brain and spinal cord. In contrast, capillaries in the choroid plexus are fenestrated and lack a blood-brain barrier. In the choroid plexus, tight junctions between the choroid epithelial cells regulate the transport of water and solutes into the ventricles. What is the pathophysiology of this condition? Hydrocephalus results from either a blockage of cerebrospinal fluid flow or a mismatch of cerebrospinal fluid production and reabsorption, in which the rate of production exceeds reabsorption. Causes of hydrocephalus include the following. 1. Excess cerebrospinal fluid production, for example, choroid plexus papilloma, rare. 2. Impaired cerebrospinal fluid reabsorption due to obstruction or disruption of arachnoid villi. 3. Blockage of the flow of cerebrospinal fluid, for example, brain tumor. What is the treatment for this condition? Treatment is surgical and involves a ventriculoperitoneal shunt, which allows for reabsorption of fluid in the peritoneum. Some people may have a surgery called endoscopic third ventriculostomy. The surgeon uses a small video camera to see inside the brain. Then the surgeon makes a hole in the bottom of a ventricle. This allows cerebrospinal fluid to flow out of the brain.